So in many ways, trastuzumab emtansine, also known as TDM1, is a true milestone in the treatment of advanced HER2-positive metastatic breast cancer. But it's not only a milestone for just our breast cancer patients, it is also a milestone in cancer research. Traditionally, when we give targeted therapy along with chemotherapy, we still have the benefits of targeted therapy, but we introduce the side effects of chemotherapy. So the patients drive a benefit, however, they're also receiving chemotherapy side effects, and thereby the quality of life suffers. So what TDM1 or trastuzumab emtansine does, it still retains the efficacy of the antibody and the targeted drug, but also is able to attach the chemotherapy right to the antibody or the targeted drug. So you have two main mechanisms of action. You still retain the efficacy of the targeted drug, i.e. trastuzumab, and you're able to give delivery of the chemotherapy right to the cancer cell, so you have a targeted delivery of chemotherapy, thereby sparing normal healthy cells from damage and from side effects. So the main benefit that we have seen with the use of trastuzumab emtansine or TDM1 for patients with HER2-positive breast cancer is we have seen an improvement in survival, and we've seen also an improvement in the shrinkage of the cancer, what we call response rate. But above and beyond this improvement in outcomes, what we call efficacy outcomes, we've also seen that the quality of life of patients is also much improved. Traditionally, when we give chemotherapy, there are the side effects which are introduced as a result of chemotherapy. But in this manner, when we're giving an antibody and chemotherapy linked together, the side effects are much tolerable, and women can lead a more normal life even with advanced breast cancer. And I think that truly is the essence of this treatment. So traditionally, when we give treatment for patients with advanced metastatic breast cancer, we give chemotherapy, which itself contains and delivers some side effects to our patients. And these side effects may include nausea, vomiting, may include the risk of infection, may include diarrhea, and also hair loss. And these side effects can be very troublesome for our patients, and they're even more troublesome when they have a very defined period to live, when they know that they are going to die from this cancer. So quality of life becomes even more important for our patients when they have a very shortened quantity of life. When we see our women with advanced breast cancer, they want to lead as normal a life as possible. They know in some cases their survival could be as short as a year. In some cases it could be as long as 10 years. They're not sure how long their survival is because it's very much dependent on the response that they will get and how effective the treatment is going to be. So it's very important for them to lead as normal a life as possible. And one aspect of that is to look as normal as possible. And for them, hair loss is a sign of disease. Hair loss is a sign of cancer. So if we can offer our patients a treatment where they don't lose their hair, it is very important to them because it gives them the energy, it gives them the appearance that life is normal, and I think that is very normal for our patients when they have a very limited time to live.